Hi, everybody. Um, I received some offers and some word of other offers I didn't know about yet. People want to come down and visit me during chemotherapy, so I'm telling everybody, no, that's not a good idea. Um, During chemotherapy, I want to keep everything as normal as I possibly can here. If chemotherapy permits, I want to go into work every day, work my full work, 8 hours or whatever. I don't want someone around the house making chicken soup for me or whatever would happen. Everything's going to be normal during that period of time. But thank you for the offer. I know other people would react differently. I know other people would want someone nursing them back to health or whatever, however you want to explain it. But that's not my style. But thank you very much. I do appreciate your offers. I don't even know if I'm going to be having chemotherapy yet for sure, but it looks that way, rather than radiation, because with radiation they have to have a target area, and being that the cancer is in the lymph nodes, there is no real target area, so I think it's going to be chemotherapy. That's my uneducated guess. Yeah, but there's so many different varieties of chemotherapy. Even the chemicals are different, for different people. They mix a chemical cocktail depending on the individual, and the method of chemotherapy is so different for every patient too. Some people have to go in every day of the week, and other people once a week, or even I've heard of even once a month. And there are different methods of how they feed the chemotherapy to you. Intravenous is, I guess, the most popular. I know they also can give it by shots, under the skin or into the muscle mass or into the bloodstream. But and they could even give it by pills. You could swallow a pill, or there's a pill that they stick underneath the tongue, and you let it dissolve underneath your tongue. But it seems like from everything I've been learning up until now, it seems like the most popular method is intravenously. I went to the Oncology Center for an unscheduled visit during this past week, just to see what their layout is like, and I took the opportunity to talk to some people there, and in particular one of their people behind the counter, and she is very gracious. She answered some questions that I had about what to expect, and my first doctor's appointment at the Oncology Center is going to be on Thursday of this. The actual appointment will probably take an hour with a doctor, but he'll go over some plans with you, and he'll recommend, and that's when I'll learn what kind of a schedule I'm going to have of chemotherapy, if it is chemotherapy. The chemotherapy, I think, is going to take place in a different building from the one that I showed you online, but it's right there at the hospital complex. And it looks like the place I would be getting chemotherapy is on second floor. I saw big bay windows up there, and I saw people up there sitting in the lounger chairs, and I know that's what a chemotherapy center looks like. And I figured it was people getting chemotherapy, because I happened to notice that people were wearing hats and bandanas and stuff like that, so it looked like cancer patients. At least I don't have to worry about wearing a hat. I don't have anything to hide. I already have no hair, so that's one side effect I don't have to worry about. And side effects, chemotherapy, I suppose most of you, anyone who's had any contact with anyone who's had chemotherapy in the past already know all this, but it's a learning thing for me. I'm learning what chemotherapy and side effects and how that occurs. Chemotherapy attacks fastest growing cells inside of your body, which is cancer cells, but there are other fastest growing cells inside of your body too. Hair follicles is one. That's why your hair falls out, because it's you're disrupting the hair growing process, I guess. But also, you have fast-growing cells in your esophagus, in your throat, mouth, esophagus, stomach, intestines, that make up the lining of those areas, and without those cells producing as fast as they normally would be, your stomach acids can give you an upset stomach, obviously, or nausea feeling. Also, some other fast-growing cells is the skin. You have to be careful about sunlight on your skin. You have to wear sunscreen and wear a hat, or well, I do that anyway. I keep a spray bottle of sunscreen in my car, and I put it on all the time, every time I step out into the sunlight practically. So there's going to be no change in my lifestyle with that. And also, I always wear at least a baseball cap, and if I'm going to be out in the sun for a long period of time, I have like a farmer's straw. Blood is fast-growing or fast reproducing cells normally. The red blood cells, the white blood cells, and the platelets. Platelets is what clogs the blood up, and if there's not enough of those, you're more susceptible to bleeding. So they ask you to not to do anything that you may cut yourself, even like shaving. They recommended that I buy a electric shaver. Now the white blood cells are the ones that fight off diseases and whatever. So I have to stay away from people who are disease carriers or have a bad cold or anything like that. I gotta stay away from that, because my resistance is going to be low to fight against that kind of stuff. And so that's the white blood cells, and red blood cells is what carries the oxygen from my lungs to all the parts of my body. And I'm going to feel tired all the time. But they have medications even for that now, I hear, where they could ease that a little bit too. After my appointment on Thursday, I'll let you know what exactly my schedule is going to be from there on out. And then after I start with chemotherapy, of course, I'll put up other videos telling you how I'm getting along with it and stuff like that. But I still have the attitude that it's just one of those things. It's part of life. It's people do get cancer, and I'm one of them, and I'm going to deal with it. I wish I didn't have cancer, but I do. So that's my life continues. There's no two ways about it. So hold off until Thursday. I'll let you know what goes on until Thursday. In this tape, well, it doesn't tell me how many minutes. I hope I didn't spend too many minutes on here. But thanks for listening, and I'll catch you later. I'll let you know on Thursday. Bye now.